India ponders emergency use authorization of a COVID-19 experimental vaccine. India has become one of the countries with the highest cases of COVID-19. The reported number of infections is beyond 4 million. Now, the government is considering granting emergency authorization for an experimental vaccine. According to Reuters, the daily new deaths due to COVID-19 this month is at least 1,000, while the total deaths due to the disease already reached 78,586. Although India is behind the US in total cases, the former has more daily cases than the latter since the middle of August. These figures are hinting the government to deploy something to control the nationwide epidemic. Harsh Vardhan, Minister of Health and Family Welfare, said India is considering emergency authorization of a COVID-19 vaccination. If there is a consensus, we may go ahead with it, especially in the case of senior citizens and people working in high-risk settings. The emergency use authorization can lead to two things. First, it can reduce the timeline of experimental vaccines in Phase 3 clinical trials. But the action will not skip the assessment of the safety profile and efficacy. And second, it can enable the deployment of an experimental vaccine in select population groups. As said, people working in high-risk jobs and the elderly are eligible for an emergency authorized vaccine. The emergency use authorization may help the government restart its crumbling economy. Earlier, the government attempted to revitalize the economy, but it was easily thwarted by the sudden surge in COVID-19 cases. In Maharashtra, a crucial industrial hub, at least 1.03 million infection cases have been recorded. The numbers resulted in strict policies to contain the virus. Throughout India, several sectors have been allowed to operate under specific conditions. But many businesses remain shut due to various factors related to COVID-19. Meanwhile, the government is looking into other business types that can be reopened to keep the economy moving. Some of these business types are appealed by owners who are affected by significant financial losses along with their employees. According to Statista, a total of 4,566,726 infection cases of COVID-19 have been reported as of September 10, since January 29. Out of that, 3,542,569 recoveries were confirmed. A week before, the total cases were below 4 million, specifically 3,940,131. Without an experimental vaccine authorized and persistent lacks in communities, the cases may balloon in the coming days.